We're really pretty isolated from other vet clinics. We're 3.5 hours away from Washington State University at the referral centers, another 3 hours to Seattle. So we see everything that walks in the door. We've had to learn. We push our boundaries, we push our comfort level. We have to become more progressive in order to see the cases that the Valley demands us to see.
But we as a team have been able to rise up to those challenges and kind of adapt to the complex caseload that we are presented with. Under normal circumstances, these cases would be referred to advanced care facilities, but either because of geography or finances, those kind of things are unattainable for a lot of our clients. And so with necessity being the mother of invention, that has kind of driven a resourcefulness and a skill set among our vets that I think positions us pretty uniquely compared to a lot of other just sort of general practice veterinary teams. So now we're proficient with complicated fractures and identifying and treating complex heart diseases or responding to new and old infectious diseases or a whole myriad of complicated medical conditions that we are now poised and actually experienced with.
We absolutely value our position in the community when it comes to being a part of these special first moments with a new puppy, as well as being there when you're saying goodbye to, a family member in the clinic.
The emotional toll is not to be overstated. One of the reasons we really feel strongly about teaching and learning is we have to grow our own, whether it's DVMs, really skilled assistants, or licensed vet techs, to spread that burden. We have started the first in the nation veterinary technician apprenticeship program as a means to address this shortage so that we can help the mental health of all of our employees. It's not going to be 3 people who are on call every single night. It's going to be 15 of us who share that load.
People say burnout doesn't happen if you're surrounded by friends as easily. So I've always said that, you can be doing extremely challenging work, but if you feel you have friends, it's still very rewarding, whereas you can be doing a very, very simple work, but if you feel alone, it can be very overwhelming. So I think that for our staff, the strength is really in the friendships, and that helps us carry through those hard days in the clinic.
It's not just a series of just individual people having individual relationships that are meaningful, but all taken together, it's part of this bigger, grander picture, which is really, really rewarding.